Welcome back. There's been a lot going on with the pandemic this morning and over the last couple of weeks, from the Delta variant causing an increase in cases and hospitalizations to more pediatric infections and the need for more vaccines. And to help us sort through all of these COVID questions is Dr. Ernst von Schwarz. And Dr. von Schwarz, you and I were just chatting during the break. I want you to spell it out clearly for people. What are you seeing compared to 10 days ago and then now in hospitals that you work in?
Yeah, good morning, Joe. Yeah, I told you 10 days ago in one particular hospital I'm going to, we had 5 COVID patients total. As of yesterday, we had more than 80. And it is the people, and some of them came to my office weeks ago and they said to my face, I don't want to be a guinea pig. I don't want to get vaccinated. I don't believe in that. These are the same people who are now on the ventilator in the hospitals in a dire condition. More than 95% of the people we are seeing now with COVID, with severe respiratory distress on ventilators and intensive care units, are unvaccinated people. And that's just avoidable. Get vaccinated. I don't care what's on the social media, all the false notices. It's clear that if you're not vaccinated, you have a much higher risk of getting sick, getting hospitalized, and dying from it.
Yeah, the numbers are pretty stark when it comes to vaccinated versus unvaccinated. You may get Delta if you're vaccinated, but you may not even know you have it, or it won't be as severe. You certainly won't be hospitalized, most likely, and you won't die. That's the numbers are pretty clear.
Well, there's a breakthrough cases, but this is 0.001% of all vaccinated people can get really sick with Delta or die of it. That number is even much, much smaller. The fact is that even if you're vaccinated, you can get the virus, you're right. And even if you're vaccinated, you still can spread the virus to someone else. Even more important is that this someone else people are vaccinated, because if not, they are just at higher risk. We all can, if you walk in the rain, we get wet. We use an umbrella, that's like wearing a mask. It helps somewhat. We use a raincoat that prevents us from getting really wet. That's like our vaccination. We still have the rain outside. We can spread it, the water, to other people around us. That's how it is with the COVID vaccine.
Now, people that can't get vaccinated are kids under 12 right now. We're hearing that there are pediatric cases on the rise. Is Delta more dangerous for kids, or is it just so highly spread in the community that more kids are getting caught up in it? Or do we know yet?
Well, what we know is it's not more dangerous. It doesn't cause more severe disease. Maybe the Delta Plus, the new one, might, but we don't know much about it yet. But it is much more transmissible. Some people argue that probably everybody will get, in a way, contact to the Delta variant and will get it.
We've talked about hospitals a little bit. Are we better prepared this time around? Obviously, a year and a half ago, this was all brand new. We didn't really know what to expect, and hospitals were playing catch up. Are hospitals ready? What have they done to be ready for Delta and the next variant that may come?
I think we are much better prepared at this point. We use much more the monoclonal antibodies for early treatment, if patients come in early, for example. And not everybody with COVID-19 needs to be hospitalized at this point. But the ones in severe respiratory distress, we are as aggressive, if not more than before, with ventilator therapy, because we know that is needed if someone has hypoxemia, meaning severe lack of oxygen. I think we're a little better prepared, but we still see people dying, of course.
All right, Dr. Ernst von Schwarz, we're out of time. We're going to have to leave it there, but so much more to talk to you about, and we'll have you back on real soon and as we deal with this pandemic. But thanks for joining us.
Thank you, Joe.